My name is Evan Nadler, and I'm representing Adipomics in our SARS-CoV-2 testing system, which is known as COVID-Spot for when you need a COVID diagnosis on the spot. So why do we need this test, you might ask? Everybody's sort of sick of this topic and sick of this disease. But the reality is that we all have friends or family who've taken a couple at-home antigen tests, still are sick, and then have to go off and get a PCR test before they're diagnosed. So we all know that the accuracy and specificity aren't great. And some of the at-home tests can take up to 15 minutes for the lateral flow assay to work. And since there are new variants always emerging, and most of these antigen tests were developed against the original strain, the accuracy continues to be an issue. Lastly, unfortunately, SARS-CoV-2 is going to be here forever, and testing will always be needed. Think of sort of like mononucleosis and the monospot test. That's our brainchild for COVID-Spot. So what do we have? We have a low-cost, highly sensitive assay for SARS-CoV-2 detection that will revolutionize the testing paradigm. Can be used anywhere, including home, school, airports, or anywhere where a on-the-spot, quick, accurate diagnosis could be useful. And it's also a platform technology which would be easy to multiplex, meaning for this fall, when everybody gets sick and comes into the doctor's office or goes to their local pharmacy and they want to know whether they have the flu or COVID, our test can easily be adapted to test both. Also for new viral threats as they emerge. So again, to reiterate, the problem is that cost-effective, widespread testing is still needed. 2 years into the pandemic, we are still struggling to have adequate testing in this country and all over the world. So what's our solution? And frankly, after hearing the talks earlier, I was thinking about our disposable pipette and thinking that I need to make it out of something more sustainable, but that'll be the 2.0 version. Because right now our focus is on cost, and it's a disposable pipette with a nitrocellulose assay system. And the technology is based on the molecular mechanism by which the virus actually enters into the cells, and thus isn't likely to be a problem with new emerging infectious variants. Our level of detection is nearly as good as RT-PCR, and it's as good, or if not better, than the best antigen tests on the market. Again, no training is really needed, no complex sample processing, and our sensitivity and specificity are about 90 and 100% respectively. That's what our product looks like. It's a disposable pipette and a nitrocellulose paper in a cassette. And the way it works is, although there's a color change with the application of the detection peptide, we actually use a cell phone reader to make the detection more sensitive. And also that makes it easily uploadable to whatever reporting system is required. The secret sauce is basically twofold. One is this disposable pipette. So this disposable pipette allows for microliters of fluid to be deposited right exactly on the spot where the detection peptide is located on the kit. So you don't have to wait. Anybody who's taking a lateral flow, you have to wait for the liquid to come across the membrane, and depending on the viscosity of the fluid and the membrane, it can take some time. But here we have a mechanism by which you can obviate that step. The second piece of the secret sauce is our gold nanoparticle detection peptide sensor system. So gold nanoparticles, when they aggregate, change from red to purple. And with our specific peptide that we've developed to detect the receptor by which the virus enters the cells, that combination is what allows us to have such a highly sensitive assay. So what are the key metrics, or why do we think this is an important product to get to market? So again, it's within 2 minutes you have your answer. And the cost per unit can be less than $10 per kit once it's scaled. It'll be easy for the next wave of the pandemic or endemic, which is the flu season coming up this fall. And then if you want to make the multiplex assay for other viruses that are out there, again, very simple to do. And our beta testing is, as I said, about 90% sensitive and 100% specific. Where are we at this moment? We've fully beta tested our kits. We've contracted with Alira Health to make the kits and then do the required testing and documentation for the FDA submission. Although we need the money to make that happen. That's why we're here today. And then most people on the call probably know that the White House released its COVID-19 preparedness plan in March, which includes the sustained and increase in American manufacturing of COVID-19 tests. So there will always be government, or not always, but there'll certainly be government support for more testing, manufacturing in the ensuing months to come. So our company, so Adipomics is my company. We actually, this product's owned by a company called Nuomics, which is a joint venture between us and an Indian company called Nuom Technologies. And Nuomics, which is the US company, has the rights for Europe, North America, and South America. We've raised $850,000 from an initial friends and family round, and we're looking to raise somewhere in about $3 million in the seed round for the FDA testing submission and bringing it to market. And as I talked about, we really want to outsource licensing and manufacturing distribution as well. So we're open to just licensing the technology or selling the technology as is without taking it to the next step. Text expansion is easy for the future. As we talked about, we can, if emerging variants become a problem for the antigen tests that are out there, we can easily redesign our test to meet that need, or the need to detect any other viral pathogen. And the multiplex option is really where we see our kit having a huge advantage, where we can tell you what disease you might actually have. And as I talked about, it's a platform technology. This is our management team. So Rob Freistadt and myself are both clinician scientists at Children's National Hospital in Washington, D.C. The company was formed in 2015. We actually have a whole nother product line that's not part of this presentation. And Keith Othlet and Tom Marino are our key strategic advisors, with Eric Hoffman as our key board member. So I appreciate the opportunity to speak to you today. My contact information is on this slide, and I'm happy to take any questions.